Hey guys, I am Mary Frey. I was diagnosed with cystic fibrosis when I was 7 weeks old. So now that I've lived with the disease for 26 years, I call myself a professional patient. But maybe you're here because you have a family member who's recently been diagnosed with cystic fibrosis, or maybe you read about it in a textbook and you want to know more. Maybe you have a coworker with it or a student in your classroom. Let's talk about what is cystic fibrosis. By definition, cystic fibrosis is a life-threatening genetic disease that causes persistent lung infections and progressively limits the ability to breathe. But beyond that definition, cystic fibrosis affects so many different parts of the body, and I think it's really important to point out that cystic fibrosis, or CF for short, looks different in every single patient. There are so many mutations of CF, and every single CF patient prefers to be called something different. Some people like to be called CFers. Some people like to call themselves cystics. I don't know if that's actually true, but I heard that once. Some people like to refer to themselves as cystas or fibros. There are so many different terms. I call myself a CF patient usually, but some people don't even identify themselves as a patient and they like to keep it on the down low, and that's fine too. Cystic fibrosis is a genetic disease, so my parents are carriers of the gene, but they didn't know that it ran in our family until my sister was born. And it turns out my sister and I are the only two people in our family with cystic fibrosis. So CF at a cellular level affects every single cell in our body, but mainly symptomatically we see lungs affected because our lungs have too much mucus in it, which is a great place for bacteria to grow. So that means our lungs are constantly fighting bacterial infections. Daily therapy is super important to help keep our lungs as healthy as possible. The therapy we do is called airway clearance, and it's to do exactly that. Hope to clear our airways of some of that thick, sticky mucus that is in our lungs. So many people use what's called the vest. It's a shaking machine that literally helps to shake the mucus out of the lungs. You can also use exercise as a form of airway clearance, jumping on a trampoline, dancing. You can do like just about anything to help clear your airways. It is vitally important that CF patients are diligent with these airway clearance treatments because unfortunately we can't just put a pause on our lung deterioration or the mucus buildup. It happens whether we want it to or not. But we can do our part in trying to keep our lungs as healthy and clear as possible. So that often looks like hours of therapy a day. Every patient is different. For me, I do an hour of therapy in the morning and an hour at night, and then some different sorts of therapy in the middle of the day as well. There's also lots of nebulized antibiotics and medications that we can use. Because the bacterial infection in our lungs is a chronic infection, that means that it's pretty much always there. And it flares up sometimes, and that usually means that we need IV antibiotics and sometimes hospital stays. And while lungs are the main organ that is affected by cystic fibrosis, there are many other systems of the body that also are involved. The pancreas is very much affected as well. The pancreas deals with enzymes for digestion and insulin for blood sugars. The pancreas is supposed to create enzymes which break down the food that you eat and absorb the nutrients from the food that you eat. But unfortunately, the CF pancreas usually doesn't make those enzymes. So almost all patients have to take pancreatic enzyme pills with everything we eat, and that helps to absorb some of the nutrients. But it's still tricky because our bodies still need extra vitamins and nutrients because we don't always absorb all that we should. And if we forget to take those enzyme pills, our bodies don't absorb the food and it literally runs right through us. There are also some patients who have what's called cystic fibrosis related diabetes, CFRD, and that's because the pancreas also can have trouble producing the proper amounts of insulin. I don't have cystic fibrosis related diabetes because my blood sugars only really go down, so I only have hypoglycemia. So I just have to watch out for if my blood sugar goes low, I just need to eat some sugar. But thankfully my pancreas still makes the proper amount of insulin. For other patients, they may have to treat their diabetes with insulin. There's also a small population of CF patients who have liver involvement. Now, when I was 10 years old, I was in a research study and there was some intake blood work they had to do to just make sure our levels were okay, and my liver enzyme levels were elevated. So that made them think, okay, something's going on. That's when we figured out that I have liver disease. So for the past 15 years, I've been on a medication that normalizes my liver enzyme levels. In addition to liver disease, I also have portal hypertension. And I think this is a pretty small population within the CF community, but some of us have it, and it just means that our spleen is enlarged and it's basically not doing its job properly. What else is there to say about CF? Maybe I should point out some of the cool things. Like, we're salty, and I mean literally, we are salty. The sodium chloride that's supposed to be in our cells actually is on our skin. So if you licked me, I'd be salty. Although this is actually a challenge for many of us, we have to eat a lot. And our diet is high fat, high calorie, high salt. So it's kind of the opposite of most of society. So most people look at me and say, "You're so lucky, you get to eat everything you want." But on the flip side, I often don't have a big appetite, partially because I have a giant spleen in my abdomen, but also partially because some of the antibiotics we're on make us feel yucky, or just our bodies are fighting, and sometimes that just makes us feel not hungry. So oftentimes CF patients have to force ourselves to eat, or some patients have a feeding tube in their stomach which can help get supplemental calories. Another thing about CF is it is technically an invisible illness. So oftentimes CF patients hear, "You look so good." And that is meant as a compliment, and that's because on the outside you can't usually see what's happening on the inside. We may look okay on the outside, but on the inside our bodies are fighting constantly, fighting to breathe every breath, fighting a chronic infection. Basically, it's a war going on inside. So it's cool that we can present ourselves and look okay on the outside, but the reality is there's a lot more going on inside. And here's probably the biggest benefit of having cystic fibrosis. Because every day is a battle, we've learned from a young age that every day is an accomplishment, and every day that we live is a gift. While some people call us CF patients or CFers, by far the coolest term I've ever been called is overcomer. Many people have asked me, "Are you going to die?" And the answer is, yeah, we're all gonna die. But for real, because of the deterioration that CF bodies go through, it means that our life expectancy is shortened because our lungs lose the ability to breathe and our other organs come up with tons of other problems as well. So right now, the life expectancy for a CF patient is around 40. That being said, every patient is different, and that is the median life expectancy. That means some people live way beyond that, and some people don't live that long. It's not a guarantee that at 40, we're gonna live till 40 and we're gonna die at 40. That's not what it means. It's just giving you an idea that some patients live longer, some patients don't live that long, but right now, the life expectancy is around 40. So every day with cystic fibrosis is a journey, and every day looks different. Some days you're gonna hear us coughing more than others, and remember, we're not contagious. Each day we have to fight to breathe and to keep our bodies as healthy as possible, but there can be joy along the journey. If you're interested in learning more about what CF looks like on a daily basis, my husband and I do videos every day to show the ups and downs and the challenges of living with cystic fibrosis. Our channel on YouTube is called The Frey Life. We would love it if you would subscribe and join us on this journey. If you want to know more details about cystic fibrosis or treatment options or diagnosis or prognosis, or any of those more technical things that I didn't touch on, there are so many resources on the Cystic Fibrosis Foundation's website. It's just cff.org. And there are so many articles on there that you can just read to your heart's delight. Thank you so much for watching, and thank you for being interested in what CF is. It's kind of a small little world of CF where we are all trying to encourage each other on this journey, and it's amazing that we have people like you who click on videos or who are interested in supporting cystic fibrosis awareness. Thank you. And please feel free to share this video with your friends or family who might be also interested in sharing CF awareness and encouraging us all on this journey. And if you have cystic fibrosis, I just want to let you know we are cheering for you. Keep on fighting. You got this.